I love that I, as an orthodontist, have the privilege of treating multiple children in the same families. I love having these long-term relationships with families. It's really special. One of the things that I'm concerned about, though, when we are dealing with multiple children in the same families, understandably so, parents are concerned about the cost of the treatment. And they'll say, you know, I want to bring in child 1, and then when we're done with child 2, then I'll bring in child number 2 for you to check them out. And so that's not really the best way to go about it. The best way to handle things like that is to have all the children evaluated and for us to understand which child's treatment has the higher time sensitivity, which one is kind of more of a time sensitive treatment that is required. And so, for example, a 9-year-old sibling might need treatment more than a 12 or 13-year-old sibling with all their teeth in that are super crowded and, you know, seems like there's a big disaster. And so one of the things that I can do as an orthodontist is sit down with a family if there's 2, 3, 4, 5 more children, and we can identify the different priorities and treatment needs of each child and then figure out who's going to go first, second, third, etc. So that's the first part. Then the second part is, what do you do if there's multiple children that require treatment at the same time? How do you make that work? How do you talk to someone where they are willing to pay for one child over maybe 24 months and then they can start paying for the next one over the next 24 months? And let's say they need treatment together at the same time. A lot of orthodontists are willing to extend payment terms and they're willing to get paid later because we care about getting the very best outcome. We want the best result. And especially if we have a long-term relationship with a family, I don't mind extending the term of the payments so that way the children can get the treatment when they need it. And if you'd like to discuss the different treatment needs of your multiple children, I would be honored to sit down with you and examine each one of the children individually and then develop priorities and also help you figure out a strategy for being able to pay for those treatments. Thank you so much, and we'll see you next time.